So Keiran, as you know, it's Mental Health and Wellbeing Month at Breheny. You guys have kindly agreed to come and have a little talk to us about some of the issues, problems you may have experienced over the years while working here at Breheny and maybe before. Firstly, do you want to introduce yourself to anyone watching this?
So yeah, I'm Keiran. I've been with Breheny for probably 6-7 years, I think it is. I'm site agent with them, so worked my way up from a graduate engineer through to where I am now. Main reason I wanted to talk to you really was mine wasn't necessarily work related.
Okay.
It was I had a health issue, which then led to quite a detrimental impact on my mental health very quickly after it happened, which took a turn, and even now probably still has a bit of an effect on me now. I mean, we're talking through 2-3 years later, so 2 years later.
Okay. Yeah,
so,
okay.
But yeah, essentially I blew a hole in my lung, or put a hole in my lung, had a pneumothorax as they're called. It's the second time it's happened to me, unfortunately. I was working in Chelmsford at the time and taken into hospital, spent a bit of time in hospital with it. And obviously when you've got a hole in your lung you struggle to breathe, and that was really where it stemmed from, was the struggling to breathe side of things meant that I just took a big dive, and I couldn't sleep, so I didn't sleep for probably a week straight because I was just continually, this is after I'd actually been discharged from hospital. I didn't sleep, and then my mental health just went massively downhill, so everything led back to the fact that I couldn't breathe, and that was what I was really struggling with. So it got to the point where I was essentially just having panic attacks all the time. I just couldn't get away from there. It's really hard to describe, but I sort of had you get like butterflies. It was sort of like that, but constant. Like that nerves, but it were like a bag of nerves, but I wasn't nervous, I was just like literally struggling to breathe the whole time. And just got real bad, and I was just continually like that. And in my head, I got to a point where I was just thinking, I never had those sort of like, right, I'm suicidal. I never had any of that. But I had the feeling of, I can't go on feeling like this, which I never had the side of it as saying, right, how can I end it? It was just a case of, I can't carry on feeling like this. And at that point, luckily, Kate, my missus, she was, and both my parents were like very supportive of the whole thing.
And you were honest and upfront with them about how you were feeling.
I couldn't have not been. Right, it was at the point where I was just in absolute bits, basically. So I couldn't have not been honest and clear as to what was happening, and they could see it. It was pretty obvious as to what was happening.
So were you working at the time then, or because
I was still off?
Okay.
So I was still off on sick leave, signed off by the doctor because of my lungs. So I couldn't really do much anyway because of being pretty physically knackered from my lungs. So I was off. Luckily, I was still in constant communication with you guys at the time. So I was speaking to Dave, I was speaking to Sean Peachman as well when he was here, and they were fully aware of what was going on. And actually, I said to Dave, I said, look, in all honesty, mate, I was okay. Yeah, I am physically. I'm not in a good place because of my lungs and everything. But I said, worse than that is the fact that my mental health is completely shot to bits. I'm in a terrible place. And he said, don't worry, it's fine. No, take your time. It doesn't matter. Like, you come back when you're ready to come back. And to be fair, the doctors signed me off more to the fact that I still couldn't physically do anything without getting any out of breath anyway. But my more of a worry was, because I've been through it in the past, the whole not being able to breathe and the physical side of it, it was the mental side that came with it that was what I really struggled with. It got to a point when I was just, it was probably a week or so after I'd been discharged from hospital, maybe a bit longer, and I was at that point where I just broke down. I said to Kayla, I can't do it anymore, so she just phoned the doctors for me. I went down to my doctor's surgery and got an appointment, and he sat there with me. To be fair, my GP took me in and he sat with me for an hour and a half. I had an hour and a half doctor's appointment. Wow. So he could see how much of a state I was in, and he just sat there and just listened. And that's the whole thing I want people to realise, is that you don't need to do it alone. Yeah, I've been very fortunate. I had my parents, I had like my missus at the time, well, still is, there with me. But don't be afraid if you're on your own or whatever. There is loads of people out there, and first port of call, your doctors, they're brilliant, honestly. And I think he knew that needed to happen.
Yeah.
He sat me down, explained and he explained what was going on, which was made it a bit clearer as to why it was all happening.
Yeah.
And I don't know why, but it sort of just put you a bit of ease. It was like, hang on a minute, okay, this is fine, but it will go away. I can get over it.
Okay.
And at that point, I was like, I'm never going to get over it.
Okay.
So he did say to me, you'll be fine. But in my head, I was just thinking, Christ, this is never going to end, and it was just going to get worse and worse and worse. But he was really good. He said, imagine your mind at the moment. You're like the generation game. You've got all the items coming past on the conveyor belt. Those items are coming by at 1,000 miles an hour, and you can't take any of it in. And that's what's happening in your mind. Okay. Everything's going so quickly, you just can't focus on anything, especially with being ill and everything else. It was just confusing, the whole situation. So from that point, I actually got put on. Not what the hell am I looking for? Basically, sedatives. Okay. So I got put on like diazepam. So essentially, I got put on a strong dose diazepam, which, in all honesty, was good, because what it did is it just let me rest. It let everything just completely calmed everything down. I was able to sleep again because of it. Essentially, it knocked me out. Yeah. But at that point, I was at that desperate point that was exactly what I needed. Yeah. Which is, it sounds strange that you need to almost be put down. You almost need to be put down for a little while just to calm your body down. But I was put on diazepam for it's one of those drugs you have to be very careful with, because your body gets used to it and then you don't have the same effects with it. So I was only put on a very short period of time. I think it was about a week. Okay. And at that very, very tiny dose as well, but that tiny dose was all I needed. So he gave me those to begin with. Then he put me in contact with a therapist or a counsellor, and then they put me on a course of antidepressants. Okay. So although I wasn't necessarily depressed, I had severe anxiety because of it all, and they work in the same way.
And that was just due to the original health issue?
Yeah, that's it. So the anxiety pretty much came from the fact I couldn't breathe, and that was just constantly in my mind. I just couldn't get away from that. Yeah. So they put me on antidepressants, and he said it takes quite a while to get used to them, and obviously they take a little while to get into your system when you do first start taking them. The first lot I took did not go well at all, so the first type of tablet I took wasn't very well at all. I just couldn't stop being sick on them. So I was on them for a couple of weeks, and then they changed me over to another one and got on fine with them. And I was on them for probably at least a year.
Oh wow, okay.
So it's a strange thing, and everyone seems like antidepressants and everything, they see it as a bit of a bit of...
There's a stigma attached.
It is, that's exactly it. There is a stigma, but I think at that point, that's what I needed.
I suppose if you're in physical pain, you take a paracetamol or an ibuprofen.
That's exactly
it. If you're having mental pain, then that's the cure, isn't it? Well, not the cure, sorry. It's what masks.
Exactly that. That's the way of helping it. So Miss Kate always said to me, like, if you'd broken your leg, you would have gone to hospital and got a cast on it. Yeah. You would have got your leg reset. It's exactly the same. It's not, you can't see it, but it still needs to be dealt with.
So how long before you came back to work?
So I was off work for probably 6 weeks, I think. Okay. So obviously I had about a week in hospital, and then I had a few weeks of just getting used to the medication and stuff, and then after that I came back. To begin with, I came back on a sort of couple of days a week. Then I built up to being full time. More so because of the physical side, not really my mental side of it at all. Really, not the mental health bit. But
how did you find coming back? Because we do work in a stressful environment.
I actually found it helped.
Oh, did you?
In all honesty, because when you're sat at home, I think what you struggle with is a lot of the time. Yes, you have the conversations with the people you know and the people you live with and stuff, but it comes back to the fact you're unwell a lot of the time. Yeah. Whereas if you're at work, you find there's a lot of distractions. Yeah. And that does help. And in all honesty, that's one of the big things, is the fact that you're taken away from that constant trying to... Yeah. And I had something else to concentrate on. Okay. And that made a big difference to me. Yeah. And as I say, once the medication started to work, I'd like to think I was back to the normal guy that people would have thought I had. Yeah. Prior to that, I'd never had any issues. No. Like, I'm sure most people would say I'm quite outgoing, quite happy sort of most of the time. There's never anything other than that. But it was a strange time. In the background, I was still going to counselling once a
Yeah.
week. So I was still seeing a counsellor. I probably saw a counsellor for 10, 11 weeks.
Yeah.
Brilliant.
Mm-hmm.
Really, really good. The one that the doctors recommended, she was fantastic. It was just a conversation. It wasn't anything medical.
Yeah.
It wasn't anything like that at all. It was just you went in, you sat and you chatted.
Yeah. Did you feel like when you came back to work that you could talk honestly and openly with your workmates, the people around you, about what you'd experienced?
Yeah, I think so. Yeah, definitely. Certainly, some of the like guys who were more my age, I was more confident in speaking to and just letting them know exactly what had happened and stuff. And even like some of the senior guys, like Dave, was fully aware of what was happening in the background, and he came and saw me. He was on the phone regularly. Even when I was off, I had a phone call at least once a week, if not more than that, just to check in and see how I was doing, which was nice to know that I hadn't. It wasn't a case of being forgotten about. It was just a case of being thought of. I think more than anything, that was actually what it was. It's just someone's actually thinking, "Cross, are they actually okay? Are they going to be all right?" and everything like that. It wasn't the pressure of coming back, which is.
Yeah.
What I think was important.
There's nothing scary about opening up and letting people know what's going on.
Absolutely not.
It's obviously helped you to get through a period of time in your life that was difficult, that was a challenge.
Yeah.
So, no, it's good.
No, it was. It's and the whole point is that I think people just don't need to be afraid of having this conversation. I know everyone has a load of stuff going on at work, but personal lives, everyone has way more going on in their personal lives. And at the end of the day, you going home and having conversations and everything with people at home, or even your workmates at the end of the day, is a really, really important thing.
I think sometimes we all see our day-to-day pressures and stresses of work, but none of us see what's going on outside of work.
Exactly.
And sometimes those pressures and stresses outside of work are enough on their own to see your mental health deteriorate, but sometimes mixed with what we actually do at work as well, it can be catastrophic.
Just compounds it.
So,
yeah, exactly that. So, but no, just make sure that if anyone is feeling that way, there is people out there. Certainly, speak to people on the phone, speak to people. Doctors are brilliant. Like, that's what they're there for.
Yeah. I mean, it's quite important. Obviously, you got the support from your family and your friends, and also you were brave enough to go to your doctors. I think certainly for our employees now, it's worth them knowing that we've got our employees assistance program.
Yep.
They're there for a first port of call for people to actually pick up the phone to, if they don't want to pick up a doctor, particularly at the minute with the way the NHS is and whatever else. That EAP are readily available at the end of a phone call for people to talk to. I think it's most people know they can talk to us. They can talk to us as senior managers or their colleagues on site or their friends. We've got mental health first aiders at Breheny now, so there are people there that they can open up or just admit they've got a problem.
Yeah, exactly that.
And and hopefully we can all help them through that. And
I think once one person does it, you'll find that it becomes more of a common thing because it's getting over that first hurdle of people being able to actually think, actually, you know what, why am I worried about talking about it?
Yeah, people shouldn't.
It doesn't matter.
Yeah, exactly.
It really doesn't matter. Yeah. So like that's the most important thing, I think, is making sure that you're not afraid to talk about it. You're not afraid to ask someone. That's the thing.
And that's why it's such a great thing that you and Richard have agreed to talk to us today, in the sense that you are telling your story, you're getting it out there, and you're broadcasting it for everyone to see that there's nothing to worry about in talking about your mental health or dealing with stress, or it's incredibly important.
Yeah,
so thank you
definitely.
for
That's
taking the time to talk to us.
Not a problem at all.
Go for this?
No, absolutely not. I think
it shortens, but it gets the message out.
Yeah.
So
the main thing for me is like I just want people to know that it's okay to talk to people and go. There's so much available for people to use and now to get over it. If it's medication, fine. If it's not, it's not.
No, that's cool.
So
you're going to be one of the mental health first aiders, I think. So you'll be able to spot if anything goes wrong. I'm going to do the same. So good.
And the whole point is we're on the phone. That's the whole point of joining the SLT. We're all here. We're on the phone. It's not just us. Speak to the people on site.
We're all approachable in this business now, aren't we?
Exactly that. Even if it's a general conversation over your lunch break, it doesn't matter.